I'm going to talk about choosing your care provider. If you're early in your pregnancy, that's one of the first tasks of pregnancy is choosing your care provider, choosing your support team, choosing your place of birth. And you may be wondering, where do I want to have my baby? Where will I feel safe? What kind of care provider would I like to have deliver my baby? And there are many different options that you need to be aware of and to talk with your partner, if you have a partner, about, and for you both to be on the same page and to feel unified about your place of birth and the care provider you choose. If you're considering a home birth, think about your setting, think about your place and your surroundings at home. How you feel comfortable, or do you feel comfortable at home? Is it an ideal setting to be at home? And how does your partner feel about you birthing at home? Those are questions to really think about and consider, considering a home birth. Are you a high-risk pregnancy? And that's something to talk about with a care provider, a certified nurse midwife or certified professional midwife that do home births. And a certified professional midwife, if you interview one, they all have different services and different ways of working with pregnant couples. So consider your personality and how well you connect with that person. Do you feel safe with that person? Do you feel taken care of by that person? What are their limitations? Do they come with medical backup, oxygen? What do they do medically for you during your birth? And they might be more limited than a certified nurse midwife depending on their credentials and practice, so it's important to ask questions. Don't be afraid to ask lots of questions of your care providers when you're meeting with them, when you're interviewing them. And you can consider a professional midwife that's not a certified nurse. They are not able to work in the hospital setting. You can also consider a certified nurse midwife that might do home births. And they are certified as nurses, and they might provide more medical care if situations arise to have more medical interventions possibly at home. And they might bring oxygen, for instance, or other kind of medical supplies or medicine that you might need. So again, interviewing a certified nurse midwife, ask who their care provider backup team is if you were to transfer to the hospital, and really navigating the hospital setting and understanding the birth culture in your community and the hospital culture in your community is very important when considering a home birth or a hospital birth. You might want to look into the hospital statistics, especially cesarean rate statistics, and to kind of get an idea about the hospital culture. But keep in mind that the statistics, there are a lot of factors that go into what a statistic report says. For instance, in my area, there's a hospital that accepts home birth transfers. And when a home birth transfers to a hospital, it might mean that a cesarean birth is needed, and that might skew the hospital statistics to increase their cesarean rate. But I am thankful that they are willing to accept home birth transfers and are willing to care for a woman during their birth that were planning a home birth, and even if it skews their statistics. So consider that when you're looking at stats. There are a lot of factors that go into them, so it's not a way to fully indicate that hospital culture, but it is a way to get an idea. There are also obstetricians that you can think about for your birth, an OB or doctor, and they obviously work in a hospital setting. And I encourage you to interview many different practices if they work in a group or if they work privately. Who are their backups? What do you do if that person's not on call? Do you like the whole team in that practice? And what are their procedures? What are their protocols during different births? And what are their thoughts with interventions and low intervention birth if that's what you're considering? Again, however you plan to birth, it's important to understand different care providers and feel safe and comfortable wherever you plan to birth. One question you might consider, if you're thinking about having a doula present, I'm a doula, or even if you're not thinking about having a doula or not able to have a doula or a support person, ask the care provider, do they refer to doulas? Notice their response. Do they? Or do they feel a little bit reserved to even mention a doula's name or a list of doulas? Do you feel like they feel threatened or they're not real comfortable or don't really like working with doulas or other support people. They have their own regimen or protocol when they attend births. That can kind of give you an idea. Are they really going to be open to something that you want maybe different during your birth, or something that you might request to have different during your birth, or that you want during your birth? And how are they going to feel about that when your birth is happening, your labor is happening? So I encourage you to really ask questions. Don't feel bad about asking questions. Sometimes my clients say, I don't want to be a burden. I don't want to ask too many questions or take too much of their time. Yes, do that. It is so important, and you're not the only one that asks questions. Really know your voice and make your voice known when you are choosing your care providers, when you're choosing your support team, when you're choosing your doula. I'll talk more about what I do as a doula and the role of a doula in the next video. Another thing to consider when you are interviewing or choosing OBs, you might really want a female OB or midwife. And I really encourage you to interview all the doctors within that practice or within that hospital system, even if they're male. I work with many male OBs that I feel very comfortable and very safe with, personally and professionally. And you might connect more with a male than you even do a female if you're thinking you might want a female, for many different reasons. So I encourage you to really talk to multiple people, male and female, and you may end up having a male or a provider at your birth that you thought you didn't want that really was the person that you needed for your birth. So I encourage you to dig down deep and really trust the support person that you choose, or support people and team that you choose, and then whoever ends up being on call or present at your birth, to really trust down deep within you that those are the people that were supposed to be at your birth to really help you to have an empowering experience, a safe and healthy birth. Really trust that. And I encourage you to do your research, really practice and learn about labor and navigating labor however you plan to birth. And I am committed and passionate to help you to feel 100% ready and supported in every way for however your birth unfolds. Blessings on your birth and postpartum journey.